Sponsors, please visit ramadanfm.com.
Ramadan, 87.9 FM.
You're listening to The Health Show with your host, Abdul Rais.
All goodness and beauty, to love Him more than our life. He is all perfection, all goodness.
Assalamu alaikum. You're listening to Ramadan FM on 87.9 FM. This is The Health Show with me, Abdul Rais. Welcome to the show. You can also listen live via our website, ramadanfm.com, via Facebook on facebook.com/RamadanFM, and via YouTube Live. You can also use WhatsApp Live to call us on 07591 970 241. I repeat that number, 07591 970 241. The topic for today is COVID-19 vaccine facts and myths. And to help explore these facts and myths, I have with me Dr. Abdul Rais from British Islamic Association, Bima. Dr. Rais is a founder member of Bima, and as a GP, he has been involved in providing COVID-19 vaccine to the public. Assalamu alaikum, Adi.
Wa alaikum salam wa rahmatullah, Abdul Rais.
Welcome to the show.
Thank you very much. Ramadan Mubarak to you and all your listeners.
Jazakallah khair, Ramadan Mubarak to you too. Let me start by asking you about the latest figures on COVID-19 and on the vaccine. How many people have been vaccinated to date, and like first vaccine, and how many people have been vaccinated with a second dose as well?
Well, as far as the latest figures of COVID in the UK are concerned, they are quite encouraging. Alhamdulillah, after having quite bad January and February, things have improved significantly. I was just looking at the data today. The last 24 hours, we only had 33 deaths. Obviously, we have been one of the worst hit countries in the world. So overall death in the UK stands around 127,000. So we had two bad peaks. But alhamdulillah, because of lockdowns and because of vaccination, the actual number has come down quite a bit. So 33 deaths only yesterday, which is quite good considering that we've been seeing up to 2,000 a day before.
Yes.
And in total, 4.4 million people had COVID in UK, or 4.4 million are the ones which we know of that had COVID. As far as the vaccination is concerned, again, UK is leading in the world. So almost 33 million people had first dose of vaccination. And around 11 million, 10 to 11 million had both dosages of vaccination. So this is probably out of all of this in last 1 year and how UK has performed, vaccination probably has been one of the highlights of the activities where we have done really well. And alhamdulillah, because of that, we are seeing that the death numbers have significantly reduced.
Alhamdulillah, yes, that is very, very encouraging. And but there are also concerns, that have been highlighted from time to time as well about certain types of vaccines in terms of blood clotting and so on. I just wondered if you could shed some light on that, please, for us.
Well, vaccines, all medicines do have some side effects, and one needs to put those side effects in perspective against the problem they are there to deal with. So in UK, we have got AstraZeneca and Pfizer vaccine, and now Moderna, the third one, has started as well. So with AstraZeneca vaccine, the cases started to come up first in Europe and then here in UK, where they noticed that some people were having blood clots. So that's why in Europe it was temporarily halted. In UK, the guidelines changed that people under the age of 30, they shouldn't take AstraZeneca vaccine. Now, that tells us two things. Firstly, that our regulatory mechanism and the way we pick up these things is working, and we are constantly updating our guidelines. The guideline still stands that AstraZeneca vaccine is still being used all over the world, actually, definitely here in UK and Europe as well. But in UK, we modified that people under the age of 30, they would not take it as their first choice vaccine because there are other options available. But those who already had first shot of AstraZeneca vaccine, they are recommended to have the second shot of this vaccine. But talking about the blood clots, and it's important that people put that blood clot risk into perspective. That if the data which we've got at the moment, for every 1 million people who take AstraZeneca vaccine, 4 are at the risk of having thrombosis, and 1 is at risk of death due to the blood clots. So it's basically 1 out of 1 million, or 4 having the thrombosis out of 1 million. So that's above the age of 55. But the risk of COVID or dying due to COVID above the age of 55 is 800 in 1 million. So if 4 in 1 million have blood clots above the age of 55, and the blood clot risk due to COVID is 800 above the in 1 million above age. So there's no comparison. But when it comes under the age of 25 years old or 25 or under, the serious harm due to vaccine side effects is 11 in 1 million. And dying with COVID is 23 in 1 million. So still COVID is more harmful, but then the ratio is not as pleasant as it is in above 55. So that's why the guidelines changed for under the age of 30. So still the risk of having blood clots because of COVID or dying because of COVID is still higher under the age of 30. But then even if the vaccine is causing half of the risk, it's still a risk too much. So that's why they recommended to change it. But if you look at the overall risk of the blood clots for other things, for example, with AstraZeneca vaccine, when we look into the percentages, in 1 million, 0.0004%. So the risk of having blood clots due to AstraZeneca vaccine is 0.0004%. The risk of having blood clot by taking birth control pill, the contraception pill, is 0.05 to 0.12%. And the risk of having blood clots due to smoking, which people don't even think twice when they smoke, is 0.18%. So compare that with 0.0004% of AstraZeneca vaccine. Smoking causes 0.18%. But if you compare all that with COVID vaccine, the risk of having blood clot with COVID vaccine is 16.5%. So yes, one says that AstraZeneca vaccine has caused some blood clots, but when we look into against COVID, there's no comparison. So if any of our listeners, they had AstraZeneca vaccine and they're getting a call for second AstraZeneca vaccine, please go ahead and take it. It's still very, very safe. But if you are under the age of 30 in UK, you'll be given an option to get the Pfizer or Moderna vaccine once you get the call. So it's important that yes, there is the risk, but to keep it in perspective.
Yeah, you mentioned the age of 30 a couple of times, and I was just thinking I'm over the twice the limit, twice that age, and alhamdulillah, I've had both doses of AstraZeneca myself, and my father, who's in his 90s, he's had both doses of Pfizer, and both of us, alhamdulillah, we seem to be fine, apart from the initial sort of feeling a little bit sore in the arm and feeling a bit lethargic for a couple of days. Nothing else. I mean, neither he nor I got any fever or anything else, and I've heard that some people do get the fever, but it's just again, like yourself, trying to put things in perspective, that it's not, with majority of people, there isn't, there aren't even short-term side effects apart from a little bit of soreness and so I personally feel very strongly in favor of vaccine, and as no doubt you do, because the alternative isn't worth thinking about. Being locked indoors, sort of most of us, not away from our loved ones, not being able to see people, not able to continue with our normal life. And here's an opportunity for us to get back to some sort of norm. And I'm sure you as a frontline worker yourself, you've would have had the vaccination as well. You don't have to disclose any details if you don't wish to, but
no, sure. I've been disclosing it all along. I had Pfizer vaccines because healthcare workers, because Pfizer was the first one. So that's what we had. I had both of the doses of Pfizer, but some of my colleagues had AstraZeneca because they opted to have AstraZeneca. At that time, I remember when Pfizer came in, because it was a relatively new technology, the mRNA base. I know some healthcare workers opted to have AstraZeneca at that time because it's a slightly older technology.
Yeah. So I just want to go abroad for a while. We'll come back again and then go back again. But for the moment, the Johnson & Johnson vaccine has been in the news. They said that it was causing blood clots, and then it was said that they're going to. I know we haven't got it in the UK at the moment, but I no doubt eventually it'll probably come to the UK as well, because we need as many vaccines as possible. But it was said that they, because of the risk of blood clots, they were going to put that on hold. But then later on, the news came that they are actually restarting it from, I think, in the next few days again. I just wanted your comments on that.
It's the same. Johnson & Johnson's actually using the same method as AstraZeneca for the viral vector method, and they've seen the similar risk ratio as well. And obviously, with any healthcare provider or regulators, whenever they notice a risk, they will put things on hold until they can measure the risk, that how good or bad it is. And what we see, the data coming from America, because that's where it started first, that yes, it does have some risk, but the risk is no different than what AstraZeneca caused, or obviously compared with COVID itself, the risk is minimal. That's why they started using it. I don't know whether if we ever going to get Johnson & Johnson's here in UK, because with Pfizer, Moderna, and AstraZeneca, we probably would be able to cover the population really well. So we'll see how it goes. Moderna is obviously the new one here in the scene, and they'll get enough doses of that to cover the adult population here in the UK.
Yeah. Just for the clarity, we know that with AstraZeneca and Pfizer, we need 2 doses. Is that the same? Is that the same with the Moderna as well?
Yes, Moderna's 2 doses. Johnson & Johnson's 1, which is not here in the UK, but Moderna would be 2 dosages as well. Now, how far they'll be split apart? The trials, like other vaccines, was 3 to 4 weeks, but I think in the UK they might still do it in 12 weeks apart, the way they did first time. So the more first dose can be given to more people. But yes, it is 2 dosages. Yeah.
Again, from personal experience, after my first dose, I was given a date of 12 weeks, within 12 weeks, but in fact it was only, I think, after 6 weeks that they called me back again. So it doesn't necessarily mean that you'd have to wait for 12 weeks after the first dose. It just depends, I suppose, on availability, on manpower, if I can use that term, people power. It just depends on how many volunteers there are, because I know that they're recruiting volunteers as well, aren't they? And for not just for that, for actual vaccination, but they need volunteers for marshalling as well, if they're holding if they're setting up camps and so on, or other places where they can get a lot of people in rather than just the GP surgery. So I guess it depends all on the whole setup, really, how quickly things can move.
Well, the guideline from government they actually got quite strict later on that it has to be 12 weeks because we wanted more and more people to get the first vaccine. So you've been lucky ones where you were able to get it in 6 weeks. I actually had it in 12 weeks. So right. Because they were quite strict into this. However, it happens sometimes where the vials are available and people sometimes did not turn up, or they had some extra supply and they call high-risk people to come early to get it. But most of the times when they say 12 weeks, at the moment they are a bit strict into that they would follow 12 weeks.
Right. So perhaps it was because I am in the high-risk category with I have type 2 diabetes, and because of my age, I guess I probably got priority. So yes,
Yes.
it's possible.
Yeah.
Yeah.
Definitely.
I'm just wondering are there any other known side effects that we've had apart from this blood clotting issue? Are there any other side effects that have come into light so
Well,
far?
minor side effects, we've seen quite a few. Injection site soreness, arm pains, headaches, sweating, body aches and pains, like minor flu-like symptoms. These we've seen quite a few patients complaining of those. I personally, I've been working in a COVID service for last 1 year. I personally have not seen anyone with coming to us with a vaccine-related side effect. The Pfizer vaccine, which we knew earlier on, had some anaphylactic reactions, severe allergic reactions, but those are the people who were already known to have allergic reactions before. But otherwise, we haven't seen any. Some people did test positive after having the vaccine, and after first dose, some people did test positive later on, that they still end up getting COVID. But the data still is extremely encouraging. That you might have seen, it was in the national domain a couple of days ago, that the vaccines are protecting from the death or the ending up in intensive care up to 100% benefit in vaccines. So again, the keeping it in perspective, there's hardly any side effects.
Yes, and I think you're right that if you look at the facts and figures, everything seems to be, alhamdulillah, just sort of seems to be quite encouraging and going in favor of vaccine. And I think we need to really think about our personal safety as well as the safety of our loved ones and other people around. That it's important, how important this is for us to actually get the vaccination as soon as we get the chance to do so. Now, I'd like to come down to BAME community in general, and then we'll talk about the South Asian community. But what from what I heard, that there seemed to be a reluctance in people sort of coming forward because of various conspiracy theories and so on. I just wondered what your experience has been like, or what your colleagues' experience has been like.
Well, yes, definitely there has been hesitancy among ethnic minority groups, and we knew about that from the start. And I think me and you have talked about this before in your previous radio programs. Initially, the data suggested that in certain groups it was up to 50 to 55% hesitancy. However, when the vaccines came along, people started getting it. Lots of healthcare organizations like Bima, various radio and media outlets, various Muslim organizations, they started talking about it. We started addressing the common myths and conspiracies which people were getting. Alhamdulillah, we noticed that the uptake started to increase among our Muslim community, Pakistani, Bengalis, other Muslim community. The uptake is going above 75, and in certain areas above 80%, which is quite encouraging. To get the herd immunity in a particular community, we do want the vaccine uptake to be above 70 to 75%. So alhamdulillah, with all the effort which everyone has done, we've seen that uptake has increased. There's still more needs to be done, but when people see other people around them in the community, in their gatherings, that they had the vaccine and the benefit people started seeing, we are seeing that they do change their mind. Yes, some people, there was data that some people who had the first vaccine did not turn up for the second one. But compared to where we were 6-7 months ago, the uptake has improved significantly, I would say. But compared to white community, yes, the ethnic minority are still less, and there are various reasons behind that. Access to the healthcare services, the source where they get the information from, and then the lack of trust sometimes on various organizations. So that lead to these type of hesitancies, which is a worldwide phenomenon. It's not just here in UK, but or overall in UK, it's 90 to 95% uptake, which is extremely good. And we've seen increase. I work in an area which is quite diverse, and ethnic minority in numbers are quite high. But we've seen the vaccine uptake has been really good, and actually, thankfully, our COVID clinics are less and less busier now, and we're cutting down the clinics from next month because there are less patients of the disease, and that is mainly thanks to the vaccines.
Alhamdulillah. Yes. We have a question from one of our listeners. They're referring to the second dose. Sorry, they're saying, can the vaccine be delayed for more than 12 weeks after the first dose?
Well, ideally, no, because the trial was done in the second dose in the trials was given in 3 weeks in one and 4 weeks in the other vaccine. In UK, the evidence suggested that you still have some antibodies up to 12 weeks. So that's why they made this idea. Obviously, you would be less protected in 10 weeks than you would be in 2 weeks. But 12 weeks was a reasonable compromise so that more and more people could get the first vaccine. But if for some reason, for some emergency reason, you were not well, you were sick, or you had to travel, or you ended up having COVID and you could not get the vaccine, and now you got the chance after 15 weeks or whatever that you're getting, yes, you can still have the vaccine. So you can still have the vaccine after 12 weeks, but you'll obviously be less protected against the COVID. The more you delay it, the less protected you are. The reason we give the second vaccine is that it has this boost effect, that your antibodies are boosted more when you have 2 doses. So if you increase the gap, you'll be less protected, and the second one might not be as useful as well. So that's why it's important to have it when the call comes. But if for some reason you are unable to have it, then it's still better to have the second dose, even if it's late, than not having it at all.
Yes, I guess some people might be thinking, for example, if they've had the first dose and they suffered badly in the sense maybe they got fever and so on and so forth, they probably then that might sort of make them a bit reluctant. But realistically speaking, you're saying that really within 12 weeks is ideal.
Exactly.
And if you have to delay it for whatever reason, you shouldn't think about not getting the second one.
Exactly,
it is important
yes.
still to get the second. Yeah. And there's also been a talk about, we're shortly going to go into break, but I just sort of put this question to you. There's been a talk of a booster vaccine for the vulnerable and elderly and so on sometime in September. I heard somewhere that they're getting ready for that in case it's required. I just wondered if you could throw some light on that, please.
I think it's most of the scientific community does agree that it's almost inevitable that a booster dose would be given. When and how often, that we don't know at the moment. So the booster would be mainly to cover the variants, the mutations which we are seeing. And both of these vaccines, or actually all of these vaccines, they can quite easily be modified to cover the variants. So I think because most of our vulnerable people had it in December, January, so one would expect that by the start of winter, our elderly and vulnerable at-risk population would be offered a booster vaccine. But that might not be something that would happen every year. But probably the third dose is something which most people think would be down in the winter. People would get it. Yes,
yeah. I suppose it's probably in the longer term. It's going to be a bit like the flu jab, isn't it? You're just going to have to probably get used to the idea of having one if you're if you are in that category where you're getting flu jabs. Perhaps it'll be similar sort of situation with the COVID vaccine as well. Yeah. I guess it's early days yet, so
but difficult to tell.
Yeah, but obviously analyses are being done all the while, and the data is being collected all the time. So what isn't certain today, it might become certain tomorrow. Yeah. So we're going to go into a commercial break, I think now, if you're ready, and then we'll come back at the end in about 5 minutes. Assalamu alaikum.
Yes. Story time with Zain Bika.
Now these are stories, they tell no lies, lessons that stand through the test of time. They tell us of a path that remains so true.
Before a wolf or a cow or a monkey gets you. And the first one's about a monkey.
There once was a wicked guy, sold people lots of lies, showed something whole, cut it half, then he stole. No, that's a no-no, to others it's a low blow. Be fair and be just is the only way to go. But then Allah sent him a monkey that he loved more than life itself. What he didn't know, wherever he would go, the monkey purified his wealth. Unbeknown to him, he thought he was free of his lies and his cheating, but this could not be. His little friend cleansed every little cent and 50% of his wealth the monkey threw into the sea. So it may be later, it may be soon, but someday there's a monkey gonna come for you. Allah hates cheating, Allah hates lies, so give what's due and receive what's right.
Ooh, what about the cow?
Once was a farmer who brought lots of drama, working his animals harder and harder. Thought there was nothing but low-life creatures, bowed to his bidding and to build his riches. He had a cow that he'd overload, and on top of the cow he rode. So one day, to his enormous surprise, the cow spoke right before his eyes. He said,
This is Ramadan 87.9 FM on your dial. From sunup to sundown, we'll be with you every step of the way.
German Doner Kebab wishes you Ramadan Kareem. Enjoy your doner after dusk with us and choose from the original Doner Kebab, the KCAL, the Doner Crunch Burger, or perhaps the Boss Box and so much more. You can find your nearest GDK at GermanDonerKebab.com or bring the Ramadan experience to your doorstep by signing up for your Ramadan pack at RamadanTentProject.com. German Doner Kebab. Kebabs done right.
Waffles, crepes, cookie dough, ice cream, just what you need after a long day of fasting. Dessert Island is open until 1 a.m. during Ramadan, 7 days a week, and there is free parking at the rear. Come and see us at 116 to 118 Queensway, Bletchley. We can even deliver. Just visit dessert-island.co.uk or download the app.
Where there is extreme poverty, there are always orphaned and abandoned children. Every 2.2 seconds, a child loses a parent somewhere in the world. There are over 200 million orphaned children worldwide. Muslim Global Relief provides education to help orphaned children develop the skills they need, making positive changes in their life and breaking them free from poverty. Awarded the UK's Best Muslim Charity of the Year. Make a 100% Zakat donation. Visit muslimglobalrelief.org.
Come and visit us at Al Ansar and find fantastic deals on food and drink. At Al Ansar, we specialize in Asian groceries and HMC halal meat. We stock products from all over the world and have everything you need this Ramadan. From big packs of rice, flour and oil to dates, treats and snacks. You can find us at 153 Queens Way in Bletchley or call us on 01908 411 334.
Bismillah. Assalamu alaikum. I'm Bushra from the show Poetry in Islam. Inshallah, I will be reciting poetry with an emphasis on Islamic human rights and justice from my book Holy Jewels, as well as inviting people to recite poetry as well. Thank you very much. Assalamu alaikum.
Assalamu alaikum, my dear sisters. Come and join me on Ramadan FM show, Me, My Lord, My Iman, every Wednesday at 2 o'clock. We will be going on a journey talking about developing a positive mindset and inner self-confidence, discussing can success only come from Allah? And we will look into how we can keep our connection with Allah despite the chaos of life. Me, My Lord, My Iman, every Wednesday at 2 o'clock. See you then, inshallah.
For a list of all our sponsors, please visit ramadanfm.com.
Ramadan, Ramadan, Ramadan. 87.9 FM.
You're listening to The Health Show with your host, Abdul Rais.
All goodness and beauty, to love Him more than our lives is a duty. He is all perfection, all goodness and beauty.
Assalamu alaikum. Welcome back to the Health Show. You're listening to today's topic. Is about the vaccine, COVID vaccine, with my guest, Dr. Abdul Rais. Adil, we have another question from one of our listeners, and it says, they're sending a salam to both yourself and me, and they're saying, I'm due to take second jab on 10th of May. I have a full CT scan as I had kidney cancer the next day after the jab. Shall I delay the jab?
Walaikum salam, brother. No, not really, no. Having a CT scan, or even if your scan is with contrast, having a jab is not a problem. There's no reason for you to delay the jab. If anything, actually, it's good that you're taking the jab, so it would protect you. Not straight away though, but even later on as well. So because you've got cancer, may Allah give you shifa. Your high risk category, so it's very important that you have the vaccine. So I would not delay the vaccine because of the CT scan, or even if it's a CT scan with contrast. There's no reason to delay the vaccine. It doesn't affect any of those things. You may feel slightly aches and pains, which people have after the vaccine. Just take a couple of paracetamols and go ahead with your CT scans. So keep your appointments, please.
Jazakallah khair for that. Wanted to talk about the variants. I mean, there's we've got it all started with our own variant. Well, it didn't start with that, but there was talk about UK variant. There was talk of Brazilian variant and South African, and now we're talking about Indian variant. I just wondered if what your view is on what we've got so far in vaccines, whether they're strong enough to be able to cope with these. And I know you said you can tweak the existing one. So where are we? And are there likely to be some more in the future? Some more variants?
Yes, the scientists who are expert in these things, they tell us that the variants, it's nothing unusual. They expected them. There are actually much more variants out there than these 3-4 which we know of. But the reason they are more worried about these variants is because they at the moment people do not have enough immunity against the disease, and some of these variants, they increase the way the virus spreads, and some of these variants actually are more harmful as well. So once there's enough immunity in the community for due to vaccines, or because the virus has spread so much, then these mutations are not as potent. The vaccines at the moment, the evidence does suggest that those people who've got both dosages, they are protected against most of these variants. Definitely, they are protected for the serious illness. There were some studies that some of the vaccines might not be as good in preventing you getting so they were saying about South African variant, that you could still end up getting up to 50% of people will end up getting COVID. However, the data which we have got so far does suggest that even with these variants, vaccines do prevent you getting serious disease, which is the ultimate objective of the vaccines anyway, to prevent the workload on NHS, to prevent the intensive care admissions. And vaccines at the moment, they are preventing these variants. But later on, once they give the boosters, hopefully they will prevent even the milder illnesses as well. So to answer your questions, yes, they would expect more mutations, and mutations actually tend to happen in the areas where the virus spreads more as well. So it's not surprising that we had UK, we had Brazilian, South African, now India. So the mutations, these dangerous mutations, are coming from the areas where the virus spread quite widely. So if we follow the guidelines, do the social distancing, and prevent the spread of the viruses, then hopefully the mutations that would come up would not be as dangerous as we've seen before. And it's still important to get the vaccines to slow down the spread and like we said before, to prevent getting the serious form of the disease.
And I suppose, like nothing is 100% foolproof. So just because we've had both doses, we shouldn't be complacent either and sort of think I can go around and do what I like now. I can visit people, I can have parties, I can do whatever. It is important, I think, that we realize that until everybody's been vaccinated, everybody who needs to be vaccinated has been vaccinated. We will have to abide by the rules as set by the government, face masks and social distancing and not going into people's houses and so on and so forth, or not gathering, together.
That's very important. So it's very important to follow the guidelines, even if you're fully vaccinated, because not everyone is vaccinated to start with. But hopefully the time would come, and fairly soon we expect here in UK when
Inshallah.
the restrictions would slow down. I mean, we're seeing what's going on in India. But today in New Zealand, they did a big music concert where 50,000 people were present. So yes, once you develop enough immunity in the community and you stop the virus spread, then these restrictions would ease. But all of us have to work hard. Everyone has done wonderful so far. But if you keep on and stay put, and even if you had the vaccine, you follow the guidelines, then hopefully soon we'll be able to get our freedoms back.
Yeah, and so there is no room for complacency, really. That's the bottom line, isn't it? And you mentioned New Zealand. I guess New Zealand is probably, it was easier for them to control, being an island, being not as densely populated as, say, India, for example. So they were able to control it properly. But each one of us, we have to take our own individual responsibility, while relying on what we're told by the experts, and trying to abide by the rules that have been set by the governments. How are you finding it in your area for people? Because I know where you are in Birmingham area, there's a large South Asian community. How are you finding it among them, particularly now in time of Ramadan, and we've got mosques and people want to go for prayers more than they normally would. How's that functioning there?
Alhamdulillah, what I would say, that the role of the masajids have been extremely positive throughout this pandemic, and they have really followed the guidelines. There hasn't been any single reported case where the virus has spread from the masajid, and they have been open throughout most of the time. Actually, they have been open. In the second lockdown, they have been open. And I've been working with through Bima with various masajid, and we've seen in the Ramadan as well, the social distancing and wearing face masks and all these things have been, the masajid and people who attend the masajid have really complied well with the regulations. In Birmingham and in surrounding areas, alhamdulillah, so far the spread of the virus has been quite controlled, slow. The top 10 areas in the country, the data which was released about 10 days ago, not one of them was the area with high South Asian or ethnic minority community. Thankfully, for change, to be fair, in all the previous lockdowns, our areas have always been the worst affected. But this time it's been quite good, and actually community has suffered a lot. Lots of people have passed away, and may Allah have mercy on them, and lots of people have been unwell. In Birmingham area, the intensive care in all our bigger hospitals have been filled up with our own Asian people, and especially young in our community have filled up, especially in the second lockdown, badly affected. But alhamdulillah, at the moment things have been under control. The thing which all of us need to prepare for is the next winter. We knew that once the summer hits, the virus would be down anyway. The effect of the vaccine, plus so many people already had been affected with it. But what we need to know come September, October, November, once probably the immunity due to getting the virus before or due to the vaccine, the immunity might start to phase off. And then we generally see that the viruses come in the winter anyway. So what all of us need to prepare for that. If you haven't had your vaccine, you get your vaccine. and make sure you keep on following the guidelines once we enter into the winters, that we are fully prepared this time to face this virus, and hopefully we won't see the third wave or the fourth wave, and we won't have to go through the lockdowns again if everyone's careful.
Inshallah. Just to inform you that the question you answered about can I delay, I think it was to do with that, can I delay my vaccine? And also the other question was about the having had the having the next jab and then having to go for CT scan, etc. They're just grateful for you clearing up the confusion. So we talked briefly about our community, and alhamdulillah, it's really positive that in the Muslim Ummah we're finally, in this country at least, taking notice of what's going on and trying to abide by the rules. But at the same time, we did have issues where in Pakistan, I think there was the UK variant was transferred through travel, people traveling there, and it caused a lot of issues on people on coming back, because then Pakistan was placed on red list and for traveling, and also now I believe India is. So our thoughts go to all those people who need to go and visit their loved ones for whatever reason. Sometimes you've got an elderly person, a loved one who may be unwell, you want to go and see them, and equally those who may be over there trying to get back home into the UK. Restrictions are there. So what advice would you give to people?
I mean, this travel and the chaos that followed after that has been probably another sad story among many sad stories in this COVID pandemic. Lots of people went, traveled abroad, although the government guideline was that you travel only if you really have to. And there were some strict criteria. Most of the people probably do travel because they fit the strict criteria. They had to meet their parents or attend a wedding or these type of things. But initially, lots of people did end up, in one data was that 30,000 people traveled to Pakistan in few weeks. And then obviously when the country was put on red list on a very short notice, the people really struggled coming back, paid a lot of money. I know people who got quarantined in the hotels, and then the issues with the quarantine and all the restrictions, and if you're with the family and children, it wasn't easy at all. But alhamdulillah, at least people are alive. They didn't suffer seriously. They were able to come back. Our advice to people is to obviously only travel if you really have to, because travel exposes you to significant risk, but is exposes, and we've seen what happened in Pakistan. And actually the Prime Minister of Pakistan came on the media and said that people traveling from UK have been one of the reasons why the virus has spread there so widely. So all of us carry some responsibility, and the healthcare resources are quite scarce back home. And it's access to health is not that easy. So it's very important that yes, all of us want to travel back. I haven't been for more than a year now, and all of us are craving to go back. But the hassle it causes to people back home, to our families, and then coming back again and going through all the trouble. So it's not the risk worth taking. While I was on the radio with you, my father called, and I just said to him that I'll call you back. So yes, we've got means to stay in contact with our parents and loved ones, but it's important to follow the guidelines. When the summer holidays would open up, yes, everyone's having an urge to go on holiday and enjoy the sun and the sea and all those type of things, and go for Umrah and Hajj. But it's probably one more season we have to have staycation and stay home and leave our desires for one more year, because there's nothing more important than saving a human's life. And us not going on holiday one more year, or not going for Umrah or Hajj for one more year, if that helps to save the people where we are going, or prevent or slow down the spread of the disease, it's not a bad deal. But if you're fully vaccinated, and there are certain areas which government allows you to travel, then yes, you follow the guidelines and travel. But unless you really have to, it's important to avoid traveling.
Well, I think apart from the obviously human cost, there's also the financial cost. More and more places, I think in Pakistan, they're doing what we're doing for people coming up from over there here, which is like, you've got to be quarantined, you've got to be in a hotel for X number of days. I think they're starting doing the same, and that's at your own cost. So, there is that side of things as well. And if you're traveling with a family, it's going to cost you quite a bit. And I understand certain airlines, I'm not going to mention any, but certain airlines are also taking advantage and charging through the nose, so
every airline is doing it, I think. Every airline has charged.
So we have to obviously prioritize things, as you say quite rightly, that the advice that's given to the government by the experts, we have to understand whichever government we're talking about. That is all I wanted to talk by way of the vaccine. We have some time left, and I just wondered if we could talk about Bima in the next sort of 5 minutes or so. So because I just like our listeners to understand, to know what a wonderful job you guys are doing at Bima. So if you could.
Jazakallah for giving some time to talk about Bima. Bima, which is British Islamic Medical Association. Alhamdulillah, we've been we're fortunate in this country to have lots of Muslim doctors, scientists, healthcare professionals who are working up and down the country, and they are passionate not just for the healthcare but for their religion and for their fellow community members as well. So Bima, with keeping all that in mind, it was made in 2013, and we've got more than 4,000 healthcare professionals as our members, and they come from all sorts of backgrounds. They're not just doctors, they're nurses, physiotherapists, pharmacists, all sorts of healthcare professionals which are under the banner of Bima, and they're all volunteers. We actually pay to subscribe to Bima. We pay from our own pockets. We don't get funding from anywhere. And the idea is to provide a platform to Muslim healthcare professionals to deal with the issues that Muslim healthcare professionals might face in this country, but more importantly, to guide our Muslim community. And throughout this COVID pandemic, even before COVID pandemic, Bima was doing lots of activities. They were research guiding Muslims on basic life support principles. And actually, this is something which was started by Bima, but then Islamic medical associations all over the Muslim world took that over, and they implemented this program where in Masajid they taught Muslims how to offer basic life support, about flu vaccinations, raising awareness in the community about that. So all of these cancer awareness programs, these type of things Bima has been doing before. But since the COVID has started, Bima colleagues have taken it to the next level, providing guidelines, addressing the myths, and the literature. Like now the Moderna vaccine has come up. Bima has already produced a statement. Previously we made statements for AstraZeneca and Pfizer vaccines, and when we make these statements, we go through the proper scientific process. We invite people from the relevant backgrounds, and we go through the literature, and then we come up with the recommendation and guidance. And then on the other hand, we do lobbying towards the governments as well, to make them aware of the issues which people from ethnic minority face. So, for example, when it comes to vaccine, initially when they started giving vaccine, they were not even collecting data for ethnic minority. So Bima and other similar organizations then lobbied the government to include that. And then the issues why the Muslims in particular got more affected because of COVID, what were the reasons behind that? So to do the research in that, and then to lobby the government to include these people in high risk areas. And that actually did make some change. And you might have noticed that some people started getting these shielding letters just because of their ethnicity and the thing. So Bima has actively campaigned. So we worked with NHS, we worked with Department of Health, and the literature and the things which Bima has produced, actually, it's not just Muslims, even non-Muslims and wider audience. Millions of people have benefited in UK and then across the globe from the work which Bima has done. We know our colleagues in Jewish medical associations, in Sikhs and Hindus, they've contacted us and they've taken Bima literature and they've modified it for their own community. So all of us should be proud of the work which British Islamic Medical Association has done. And alhamdulillah, we want to continue to deliver as we go along. So all of us do that in addition to our normal day-to-day clinical work as healthcare professionals. So when we come home or in between the work, when we have breaks, all of us spend time on Bima. So you're welcome to visit britishima.org, our website. There's plenty of information about there. We produce guidelines for masajid, for janaza, for burials, for ghusl. And for Ramadan, Bima is produced along with MCB and Minab. We produce documents about fasting, whether you can have vaccine while you're fasting, about itikaf, about iftar, about Eid. So Bima has produced guidance for all of these things, and radio station like yours and hosts like yours have alhamdulillah given us forum to reach to a wider community and pass on the message. And alhamdulillah, we've seen the benefit of that trickling through now. So yes, if you know certain healthcare professionals who are still not part of Bima, encourage them to join and strengthen us.
Jazakallah khair. But just one question on literature. You mentioned literature. Is literature only available in English, or is it available in other languages as well?
Well, most of our stuff is in English. However, when it came to myth busting, Bima produced some slides. We looked into the common conspiracies and myths that have been going around. We realized about 35 to 40 different questions, which some of them are genuine, some of them are myths that come along, which people usually have about vaccination. So we made those myth-busting slides initially in English, but they got so popular, so we started translating them initially in Arabic, Urdu, Bengali, then it went on, and I think it's more than 12 or 13 different languages, including French, Spanish. It's been translated and it's spread all over the globe now. But our main literature, I wish we could translate them into multiple languages, but it's just the resources. But if there are among your listeners who look into some of the Bima documents and who are happy to translate them into their own native language, just drop us an email through our portals, through our websites, and we'll be more than happy to work with you to get it translated into your local languages.
That's great. Jazakallah khair. It's been a pleasure talking to you, and I'm sure that our listeners would have benefited from all the information that you've provided us with today. Look forward to another time, inshallah, when I can sit with you again and talk some more on this subject. But in the meantime, Jazakallah khair. If you have any quick take-home messages, then I'm happy for you to let our listeners know.
Jazakallah khair, Abdul Rais, for inviting me again. It's always a pleasure talking about these things. Well, we're going through this blessed month, and just we recommend everyone to pray for yourself, pray for the fellow Muslims, pray for whole Ummah, and come Eid, it's important that we follow the guidelines. We don't want Eid to do with us what Christmas did for the wider community when we saw the second wave after Christmas. So during this Eid, follow the guidelines. Hopefully the weather would be as nice as it's now, so stay more outdoors. You can gather outdoors, keep the social distancing and enjoy your food and stay safe. And if you haven't had your vaccine, and when you get the chance, please go and have the vaccine. It is safe. It prevents a serious illness. But at the end of the day, it would be your choice. But it's important that you make that decision as an informed choice and speak to the people who can give you unbiased, non-biased opinion. And yes, contact us. We are available through Bima if you have any questions, and we'll be happy to answer you.
Jazakallah khair. Well, on that very important message and positive message, the program comes to an end. Inshallah, we'll be back on next Saturday with another guest, another topic. Meanwhile, I'm back inshallah on Monday with my Urdu show. So until then, take care, look after yourselves, and keep us in du'as. Assalamu alaikum.